There's this moment in the game Cyberpunk 2077 where you're walking down the street and all of a sudden you see scavengers tearing people to shreds and harvesting their organs as part of a scary organ black market. Safe to say, when I first saw this part of the game's world building, I was horrified, but also a little intrigued. I mean, I don't need both of my kidneys, right? So, what if I let someone cut me open and I sold just one? Well, according to the World Health Organization, I would make about $160,000. And if someone were to harvest my heart, they could sell it for about 120. Organ recipients are willing to pay these lofty prices because otherwise they might not get the organs that they need to survive. Because America is facing an organ crisis, and the way that we have constructed our system is leading to countless deaths. So today, let's dissect the system and its flaws and how it leads to mistrust and desperation. Then, let's see its deadly consequences. Before finally looking for some solutions to combat the imminent organ crisis. When I first began looking for the reason why we're facing this problem, I started from the beginning. So let's start there. In 1984, Congress created the Organ Procurement and Transplantation Network. Then they gave total control of the network to the United Network for Organ Sharing. And until 2023, the United Network for Organ Sharing, or UNOS, had a total monopoly over the market, meaning that for almost 40 years, there was no competition. And according to Chuck Grassley, Senator of Iowa in 2023, UNOS's monopoly over United States organ donation has been disastrous. Because when the lives of real people depend on that system working flawlessly, the lack of competition is more than just a bureaucratic flaw. It becomes deadly. Thankfully, senators like Chuck Grassley fought to reform that system in 2023 by passing legislation to demonopolize UNOS. However, not so surprisingly, corruption persists. You see, underneath UNOS, the power lies in the hands of 56 local OPOs, or Organ Procurement Organizations. And these organizations have control over designated surface areas, meaning that here in Tampa, if you were ever to become a recipient, you would have to go through our OPO, Lifelink of Florida. To me, this system didn't seem that problematic until I realized that just like the UNOS problem that was just addressed, these OPOs have total control. And the Center for Medicare and Medicaid Services, the governmental body which is supposed to regulate them, doesn't seem to care. Meaning that these OPOs can destroy someone's life without any consequences. For example, in 2020, one OPO threw away a recently procured kidney, making it unusable. In 2017 and 2018, two separate OPOs began operating on donors who were still alive. And it's negligence like this, which creates a mistrust that Brian Quick, professor of communication at the University of Illinois, cites as the cause of people's mistrust and hesitance. And when systems are broken, they lead to broken confidence. And as OPOs spread mistrust, misconceptions run rampant. Millions continue to believe that you have to be related to the recipient to donate. Others believe that if you become a donor, hospitals won't care about saving you. And I myself held true that organ donation was against my religion. When in reality, anyone can become a recipient of anyone's donation. The Mayo Clinic says that a donor's and a hospital's number one responsibility is to save the patient's life and not the recipient's. And religious scholars from every major religion have asserted that organ donation is a selfless and noble act. It is clear that there is simply not enough being done to educate the masses, and that has deadly consequences. In the US alone, according to UNOS, 90,000 people sit on the kidney transplant waitlist, and 11 of them die every single day. Now, it's easy to believe that this system is doing the best that it can when you're not currently affected. But one day, 90,000 might stop being a number, and instead a group that you find yourself in, hoping every single day that someone sacrifices for you, hoping that the system is working in your favor. Poet and advocate Tanya Ingram was quickly forced into the realization that the system was in fact not working in her favor. Placed on the organ recipient waitlist in 2019, Ingram fought to change the system. She talked to representatives in hopes that if the system were to change soon enough, she could survive. To me, Ingram's story is one of determination and rebellion, fighting against a corrupt system. However, for Ingram, it was too late. Because even though she was part of the movement that helped lead to the demonopolization of UNOS in 2023, in December of 2022, she passed away after 3 years of fighting for the cause. And her neighbor and close friend, Matthew Hernandez, stated that she was tired. 59-year-old Patrick Mannion was luckier. He received his life-saving double lung transplant only after having to set aside $30,000 of his own family savings to prove that he could pay for the surgery, and before having to raise an additional $115,000 to pay for his ongoing anti-rejection medication. Our system killed Ingram, and it made Mannion a slave to ongoing costs. And it is up to us to make sure that stories like theirs never happen again. Now, in searching for some solutions to this problem, everything led me back to policies. Just like the demonopolization of UNOS in 2023, our government needs to do more to reform the system. And we as a society need to do more to support the policies and bills that are already proposed. One bill that I think we can all get behind is the Organ Donation Referral Improvement Act, which was proposed in January of 2025. This bill, which hopes to streamline the referral process, is currently being discussed in the House Department of Energy and Commerce. And it is up to us to make sure that it becomes law. To do so, we need to talk to our representatives and send them letters to show our support and to force them into action. We need to talk with our family members and tell them about the bill. And we need to take to social media to advocate and support organizations which are doing the same. The thing is, this advocacy and education needs to spread past simply that bill. I want you all to tell your friends and families about the organ crisis. Yeah, I'm telling you to be the weird person who brings up organ donation at the dinner table, because in doing so, you might just save a life. And before you start advocating, make sure that your words match your actions. To do so, become a registered donor at registerme.org. I know it seems like a daunting process, but it is worth it. Because in that process, you could save up to 8 lives, and you could improve up to 75, all with the satisfaction of knowing that you're making real change. Now, if you want to be on the cutting edge of organ transplantation, support new scientific procedures like xenotransplantation, which works to transplant modified animal organs into humans. Sounds crazy, but in 2020, it was successfully done with the transplantation of a pig kidney into a human body. Even though it still has its flaws, it could be the future of organ transplantation with our support. Now, with talk of xenotransplantation, it might seem like this entire process is getting just a little bit too complex, maybe headed in the sci-fi direction. But it boils down to our understanding that organ recipients are not vicious monsters tearing people to shreds and harvesting their organs as part of a sketchy black market, only working for their own personal benefit. But instead, people like you and I, who just want another chance at life. And it is up to us to make sure that they get that chance. So remember, that change starts today.